Okay, welcome Vanessa to today. I've just got some information I'd like for you to fill out. If you could just fill out this top section here for me, just got some personal information, and if you could just pop down your condition as to why you've come to see me today, that would be great. Have you ever had a Iridology consult before?
No, never.
Have you heard about what it actually entails?
I've read a little bit about it, but I don't know a great deal.
Okay, so it dates back to around the 1800s, so it's been used in complementary medicine practice for quite some time now. It's not used as a diagnostic tool as such, so we would never make claims from having a look at your eyes as to what your conditions might actually be. It's more as a confirmation tool, so we use it as part of our assessment in terms of, I suppose, confirming ideas that we think might be going on with different systems and organs of your body.
Yep.
So your eyes actually are split up into all different zones. You've got your pupil, your autonomic nervous wreath, and you've also got, which is also called your collarette, and you've also got this zone here called your ciliary zone. There's certain markings that occur in all of these zones that relate to different organs or systems in your body. So what we'll do today is we'll have a look at your eyes, and we'll go back to use these charts and show you if anything pops up as to which area of the body it actually affects. So it also, iridology assessments also can show things that are hereditary traits, so they can be not necessarily something that's affecting your body and your current health state, but also from 3 generations ago. So in particular, you might have a family member that's had certain types of cancers or things like that. It might show up in your eyes. Doesn't necessarily mean that you're going to have the same type of cancer, but it might also be a nurture spot that we might need to pay a little bit of attention to, so that you aren't yourself experiencing any of these kinds of conditions.
That's really
But
interesting.
it's also something not to be worried about. There'll be things that pop up along the way there that you might think, I'm actually going to be unwell. It's like I said, it's just a nurture spot that we would say to be mindful of.
Yep.
We'll use 2 different types of tools. We've got a pen torch, which is this one here. That looks at, we use that side on on the side of your eye, so it shows the depth of some of the structures that we would see. And this one's an iris torch, also has a light on it, and it's the light that we look from straight on. It's obviously got a magnifying glass on it as well, so it allows us to see all the different types of shading and different structures within the eye under magnification. So what we'll do is actually look at your left eye and your right eye. I'll look at both your eyes to start off with, to see what your true eye colour is, what your pupils are looking like, and anything that pops up in both eyes in terms of constitution. And then I'll look at each eye individually, and I'll plot what I can see on each eye on a sheet of paper, and we can go through this after that.
Okay.
If you've got any questions along the way, obviously let me know. Also, if the light gets a bit much and you need a break, just say I just need a little bit of a rest because your eye's getting sore, and we can stop for a little bit. So I will... First, you're saying on your information sheet here that you've got some digestive issues. Could you elaborate on that for me? Is it something that you've been experiencing for some time, or something you've just recently
maybe 3 months.
About 3 months?
3 months. I just seem to be bloated after everything I eat.
Okay.
So I tried to narrow it down, to see if it was something specific. I tried cutting things out. I do eat a lot of cheese, so I thought I may have been overdoing it in one particular area, but it just seems to be all the time.
So you've tried eliminating things, and there's nothing specific that you can think.
It doesn't seem to be. Tea, I don't know. I have black tea anyway, but tea is really the only thing I can sort of have at least 2 cups of, and I don't actually feel bloated. But anything else, I just feel really not well.
Have you had any tests done for any type of diagnosis as to what might be going on?
No, nothing.
Okay. And do you have any family history of different kinds of digestive issues?
No, Mum says, no, not really. Nothing that, to speak of. Nothing out of the normal, I wouldn't say.
And no brothers or sisters that have the same kind of thing?
No, not that I'm aware of.
Okay, so I'll have a quick look now. I'll make some notes as well. I'll have a look at both your eyes in terms of constitution first and see what your true eye colour actually is. Like I said, just bear with me. If the light gets too much, just let me know. I just think you need to concentrate on my forehead, and I'll do your left eye first.
So are they always different, left and right eye?
So different areas of the eyes, in each eye, like different organs of the body.
Yeah,
so
okay.
in like your left eye, you have different organs come up in your left eye as they do into your right eye.
Okay.
So I'll just use the side light now. Just let me know if that gets too much. Okay, so you're a true blue eye colour.
Wouldn't have thought that.
I'll just have a look at this one as well. So blue eyes are generally more of a lymphatic type of eye, so that means you suffer more from like upper respiratory types of illnesses and inflammation.
That's
You're
so
also,
true.
you're more susceptible to colds and sinus infections and things like that as well.
Yeah.
As a child, did you have tonsillitis, ear infections, recurrent colds and things like that?
Colds and chest infections.
Okay, so that's quite often.
Pleurisy, yeah.
Okay, so that's quite often noticed in people that have a blue lymphatic type eye.
Yeah.
It also is quite you're more predisposed to people with blue eyes are more predisposed to having inflammatory conditions, so joint pain and all those kinds of things. So it's something to be mindful of as well. You do have a silk constitution, which means that all your fibres are nice and tight and close together. Having a silk constitution is really good because it means you're quite resilient. So if you become unwell, you normally will bounce back pretty quickly.
Yep.
It also means that you can handle physical stress quite well, which is also a good trait to have. What are your energy levels generally like? Pretty good.
High.
Yep. Yeah, that's a good sign of good resilience there as well. I'll have another quick look at your pupils. I'll start with your left eye again. Your pupils are quite enlarged, which means that your sympathetic nervous system might actually be a little bit overworked. How are your stress levels? I know you said your energy levels are quite good, but do you find that you get quite stressed?
I don't think that I do, but I do think I do, if you know what I mean. Yeah, I would say that I do stress more than I like to think I do.
Okay, yeah. It's quite often that kind of presentation where you've got quite enlarged pupils says to me that you do have some underlying stress. It might not be necessarily physical, it might not necessarily be emotional, it might be something in your subconscious as well, so it's something to be mindful of. Taking any supplements or anything to support for sort of stress conditions?
No, not for that. I have had St John's wort in the past.
Okay.
Which I guess I definitely found
Helped?
Yeah, without a doubt.
There's lots of other things that we can talk about towards the end of the consultation today which might help with dealing with stress kind of conditions. You also have what's called quite a large rough zone, so that just means you require larger volumes of food to satisfy yourself. Absolutely. Do you find that you have quite a big appetite?
Absolutely.
Okay.
Renowned for it, actually.
This also can be an indication of lowered hydrochloric acid levels in your gut, which might be one of the reasons why you're having some of those digestive issues. There are, which quite often with having the low hydrochloric acid, you have bouts of indigestion. Do you ever find you get indigestion as well?
Very much.
Yeah. Okay. So that's got something what's called hypochlorhydria. And that also is quite common with people that present with indigestion.
Yeah.
Also, there's lots of foods that you can and can't eat, which either aggravate or alleviate indigestion. So it's something we can talk about when we get into each of the individual eyes as well. Both eyes show also what's called central heterochromia, which is an orange colour, which indicates a little bit of pancreatic insufficiency. So that quite often affects the assimilation of the digestion of proteins in your body. So it might be one of the reasons why you feel quite sick with not being able to eat particular foods. Do you find that with proteins you do kind of feel a little bit unwell when you're eating after you've eaten them?
Possibly more so.
Okay, yeah. Okay, so this relates back down to digestive health. I think we'll find when we get into looking at your eyes individually that'll come up quite a bit.
Yeah.
That we might need to address your digestive system. So do you get constipation or diarrhea or bouts of both?
I would say diarrhea more than constipation.
Okay, we'll have a look at individual eyes now. Like I said before, we'll go through these two charts. Feel free to ask any questions and I will just make some markings first. I'll copy them down here. Okay, so I'll do your right eye first. Again, just looking at my forehead. Have a quick look at your left one as well, and just put some markings down there too. And another one. Okay, so I'll start with your right eye. So as I was saying before, here's in this chart here, it shows the different zones of the eye. So there's your pupil, there's your ANW or your collarette. This is your ciliary zone. So your collarette is saying that it's quite erratic and has quite a jagged edge, which indicates there's obviously those digestive issues there with particular bouts of constipation and diarrhea. It's quite often presented in people that have irritable bowel. As you've said before, with the bloating and the bouts of diarrhea, do you feel like with the diarrhea it's all the time, or like how many, like certain times a week, or
Probably 2 to 3 times a week.
Okay. But you're still not sure what it is that...
No, and to be honest, I haven't actually. I probably should be taking a food diary or something, because it might be one particular thing that I've am eating, and I can't remember. But yeah, there is probably a good chance.
No allergies?
Not that I know of.
So when you do have these bouts of diarrhea, do you take any form of probiotics or fermented foods or anything like that to try and combat around this, or you just sort of
Inner
persevere? Inner health,
Just
love?
the good old inner health.
Okay. And do you find that helps with alleviating some of the symptoms, or it just seems to keep going as it is?
I think I don't know, because I tend to only have that one bout of diarrhea, and then it stops until for a day or two, whether I have the probiotic or not.
Okay.
So I don't really know that it's doing anything major.
And there's been no illnesses like gastro or anything like that that you think might have started it?
No.
Okay. So in your ciliary zone, you had quite a prominence, what's called a scurf ring, which indicates that you might have some reduced skin elimination function. Do you suffer from any kinds of skin conditions like eczema or dermatitis, psoriasis or anything like that?
Dermatitis I've had on and off my whole life.
Okay. And do you use any treatment for it? Any steroid creams, any natural creams?
I have used the steroid cream in the past, just the really low percentage one.
Mm-hmm.
And then I don't really like using that though, so I've tried lots of different natural
things
therapies
as well. And do any of those seem to work?
Yeah, well, there was a goat's milk soap that seemed to bring it down a bit.
Okay. Are there anything that you can pinpoint that actually you think triggers these kinds of flare-up of the condition?
Yeah, definitely. I'm a hairdresser, so I know that I don't do colours anymore because they definitely tend to bring it on, and anything too heavily perfumed.
Okay, so like a chemical contamination kind of problem.
Yep.
Okay, because one of these with having this kind of presentation also tells me that you've got poor elimination of toxins. Given your digestive health, it's quite possible that there is quite a bit of toxic build-up in there, so your skin's having a hard time with getting that out as well. So I think if we address a little bit of your gut health there, that would also increase the capabilities of your skin to help with the elimination there.
That'd be great.
You've got quite a large lacunae, which is a oval shaped fleck, I suppose,
Yep.
in your at 5 o'clock. So it's over here, and it's to do with your lumbar spine. Have you ever had any kind of back injuries or chronic back pain or anything like that?
I always have lower back pain.
Lower back pain.
Having been a hairdresser for a long time, I've
Okay.
just always thought it was part of the course. And I did have a severe back injury years ago, and spent quite a bit of time in hospital.
Oh, okay, like a break or a strain or
Yeah,
a...
break.
Oh, you broke it?
Yeah.
Okay. How old were you?
27. I'm 45 now.
Was it from a motor vehicle accident?
Surfing
or...
accident.
Surfing
motor.
accident. Okay. So was it to the point where you couldn't walk or anything like that, or you had to?
Yeah.
Okay,
Yeah,
so it was a full rehab.
Yeah.
That's interesting because that's quite a prominent sign in your iris there, in your right eye on that lumbar spine region. You've also got another psoric spot on your liver that you might have noticed. So it's a really dark, prominent spot on the lower portion of your iris. So you might not have seen it in your eye, I'm not too sure. But that indicates there could be some liver issues, not necessarily yourself, but somebody in your family. If anyone in your family had any liver problems?
Not that I know of.
No.
I definitely drink too much red wine, so that may have something to do with it.
So no family history, but you think, have you ever had any liver function tests done or anything?
I
like
have
that?
had one done, and surprisingly it came back fine.
Okay,
I wasn't expecting it, because I'm above the 2 glasses a day.
okay. So,
So
you
maybe
do
I need
like
to-
alcohol.
Yes.
So that's probably something that you could, one of those spots I was saying is a good nurture
Yeah.
spot, something you could look after. And obviously there's
Yeah.
lots of herbs and supplements that you can use to help encourage good liver function, because obviously your liver also has so many other functions with the rest of your bodily functions. So it's important probably to have a look at your liver and ways to incorporate different types of foods that are promote good liver health. What was quite prominent in both your eyes is you've got radii solaris, which is and it's heading up towards your head zone in particular. Do you suffer from any other types of mood conditions that you feel could be worth noting, maybe like depression or anxiety or things like that?
I'm definitely quite, I would say, anxious. I can be. Yeah, definitely.
Is it circumstantial, do you think, or is it something that you deal with every day, or?
Yeah, I seem to find something to be anxious about all the time.
Is there anything that you can do to actually calm those kinds of racing thoughts?
Yoga.
Okay.
Yoga, and definitely any sort of meditation. I've found if I'm in bed, chamomile teas, that was where the St John's wort thing came from.
Yeah.
It does help. It's
Does
definitely a case of training
Is it
yourself.
something
not
that you've
to-
always had, or?
No, I don't think so. No,
Okay.
I think it's definitely as I've gotten older.
This kind of presentation also, there's a link between the gut health and these kinds of mood disorders. Obviously, having a poorly functioning digestive system can affect the types of neurotransmitters and things like that that are happening in your brain. So I think addressing your digestive system would also help with these kinds of anxious days that you might be having from time to time. So I think if we concentrate on getting your gut health up to scratch, that could possibly help alleviate those kinds of things. But you're on the right track in terms of maintenance and doing some yoga and meditation. If you can find some time to just keep yourself calm, that obviously is going to help with the anxious types of attacks. I'll have another quick look at your left eye again. So with your left eye, we'll look at this left sheet here, the pupil edge has quite a grey shadow around it, which also indicates the hyperchlorhydria that I was talking about before, the low stomach acid. And that, like I was saying, has if you've got that kind of presentation, you've got a harder time digesting proteins, and that also can lead to the bloating and feeling really full after you've had quite a heavy protein-rich meal. I think that's probably something that we really need to address first with the whole presentation of the gut issues that you're having, because quite often if it's left untreated, it can lead to malabsorption because you're not being able to absorb the nutrients that your body is trying to process through your small intestine in particular. There's a number of ways that you can support this is through digestive enzymes in particular, and really healing that gut lining through taking things like glutamate and including things like gelatin and bone broths and real gut nurturing kinds of foods to repair that lining so that it has the capability of being able to properly digest these proteins and things like that in the gut. So there's definitely supplements that can help, and there's also foods that can help, which we can talk about.
So just like powders to add to my food, or you know, like capsules, or
so digestive enzymes you can take as a tablet. Yeah, but a lot of the foods that you can eat, like incorporating the gelatin and the collagen into different types of meals, obviously making bone broths by adding them to soups and stews and things like that was all really nurturing for the gut lining and to get that repair phase going. Then we can populate the gut with some really good beneficial bacteria, which will help with the effectiveness of the gut and it's being able to carry out its daily functions. And with all of that presentation, because most of your immune health comes from having a really good gut health, hopefully that will help with other illnesses, particularly the respiratory ones that you say that you experience, having that lymphatic type of constitution in your eye. As a general health thing, you should also improve if we get your gut health going.
That'd be great.
You've also got quite a prominent lacuna in your arm zone, so it's over here. Is there anything, you haven't broken your arm or had any injuries or anything in your arm? No.
Not both elbows. Always almost like arthritis or just tender a lot. But again, I tend to always relate that back to work.
So I do more so work related?
I think so. I quite frequently wear compression elbow.
Because your arm's always up in the air being a hairdresser. Okay. And so how long do you think you've been suffering with sore arms for then? Well, how long have you been hairdressing for? 25
years, and it would be the last 5 years for sure.
Okay.
I do take the supplement, the joint...
glucosamine?
Yes, yes.
Okay, so that could also be the inflammation that you get from having that true blue colour eye as well. Like I said earlier on, that blues generally have that kind of inflammatory kind of response to things like that. So there's something to be mindful of. Obviously, there's lots of foods that you can eat which help with inflammation. Turmeric, all your good omega-3s are all good anti-inflammatories, so it might be worthwhile adding those to your foods.
Okay, so like fish oil capsules or something?
Yeah, that would help too,
I haven't taken them, okay.
Yeah. You've also got quite a few asymmetric darker pigments within the ciliary zone of this iris, which indicates you might have a bit of a sweet tooth. Do you enjoy your sweets?
Maybe. Yes, I do.
Daily or any in particular times of the month?
Yeah, absolutely.
Yep.
Yeah, around that time of the month, always. I do. I love my dark chocolate. I do try not to overindulge. I'm pretty good with it. I do tend to control it, but if I gave into it, for sure.
Okay.
Meringue pie for breakfast, probably.
Interesting. Okay, so overall, I feel like for yourself, obviously the condition that you've come to see me for today is purely because of your gut health, and that does come up a lot within your diagnosis or your presentation today. Is there any other questions about some of the things that I've mentioned that you might like more information on?
No, not really. No, I understand what you've said.
So I can give you some more information. We can have another consult if you like, and go over all of your body systems and have a really good thorough check, so not just by going off of your Iridology.
I like that idea.
Yeah, and I can give you some more information and pamphlets on foods to eat, different types of supplements that I think we could recommend in terms of your digestive enzymes, and having a look at that hypochlorhydria and supplementing possibly with some hydrochloric acid,
Yeah.
which will help to get that acid base level correct within your gut. That will help with the digestion of the proteins and hopefully alleviate some of the bloating that you're feeling after meals. In terms of your nervous system, which we said was evident with the size of your pupils, you could probably introduce some B vitamins. Activated B vitamins are really, really good for people that have a little bit of digestive upset because they've already been partially broken down, so the body can more easily assimilate the B vitamins.
Yes.
So I think that would help with your nervous system.
Yeah.
And obviously continue to do all the things that help with reducing the anxiety and stress levels
Except
if you
less
have
wine.
any. Except for maybe less wine.
That would be good.
So if you like, I can make another appointment for next week if you like, and
That'd
we
be
can go
really
over
great.
a full
Yeah.
assessment.
Yeah, I'm really interested in. I like the link of idea of being able to, like you said, the nurturing of the other things.
Yeah.
I think that's really good.
Yeah. Okay. So I'll just get a card. How is next Tuesday at say 10 o'clock?
Perfect. I have Tuesday off, and it's after school drop off.
No worries. Well, in the meantime, if there's any other
Thank you.
questions that you think you might have, just send me an email or give me a ring and we can go over them. But I will talk a little bit more in depth about different things that we can do in particular for your digestive health and maybe to nurture your liver that little bit more as well at our next appointment.
Excellent. That was really interesting.
Great.
Thank you
for coming
so
today.
much.
No worries.